want to share some tips in relation to managing your tinnitus. So firstly, wearing hearing protection. So say if you're exposed to loud sounds or noisy environments on a day-to-day basis, what hearing protection can do is prevent hearing loss or further loss if there's already a hearing loss present. Just because, as Anita mentioned earlier, there is that association between hearing loss and tinnitus. And so we want to do what we can to protect our hearing. Then using a hearing aid if you're experiencing hearing loss. So as we mentioned earlier, when someone has a hearing loss as well as tinnitus, what a hearing aid can do is amplify all sounds so the tinnitus itself is less noticeable. And there's also now different settings that can be applied to hearing aids with the overall aim of masking the patient's tinnitus as well as reducing their perception of it. So thirdly, relaxing. So we had a question sent in to us in relation to the effects of stress and tinnitus. And we would say that reducing stress is very important to the overall management of tinnitus. So just implementing exercise or relaxation techniques into your day-to-day life can help you feel less stress and then provide some relief from your tinnitus. So things like meditation, mindfulness, or even taking a walk can be beneficial in reducing tinnitus-related stress. Another strategy is to take your focus away from the tinnitus with other sounds. So again, we had a comment sent in to us that the person's tinnitus is more noticeable in quiet or at nighttime before they go to bed. So we'd say that the use of background sounds can help you draw your attention away from the tinnitus. So there's lots of different apps out there that provide sounds like white noise and nature sounds. We can also use environmental sounds from your day-to-day life, like the radio or television, to help with your tinnitus. And the final tip that we would give is to get assessed in some way. So whether that's by your GP to determine if there's any medical implications to your tinnitus, by the audiologist to determine the level of hearing loss, or by a specialised tinnitus clinic like Neuromod Medical. And what we do here at Neuromod is take all the different aspects of your tinnitus experience into account and then create a management plan for you, which is both individualised and tailored to your specific needs.